Contents of the femoral triangle. The main contents of the femoral triangle are femoral artery and its branches, femoral vein and its tributaries, then femoral sheath covering the upper 4 cm of the femoral vessels, and nerves. In the nerves include, this is the femoral nerve which is outside the femoral sheath, and also ilioinguinal nerve we get near the superficial inguinal ring and nerve to pectineus, and also deep inguinal lymph nodes. Now coming to the femoral artery first, this is the femoral artery. Femoral artery, it begins at the mid inguinal point, which is the midpoint between pubic tubercle and anterior superior iliac spine, as a continuation of external iliac artery. Now this femoral artery gives 3 superficial branches and 3 deep branches. 3 superficial we have already seen: superficial external pudendal, superficial epigastric, superficial circumflex iliac. Now among the deep branches, this is the profunda femoris artery, which is the largest branch of the femoral artery. It arises from the lateral aspect of the femoral artery about 4 cm below the inguinal ligament. So this is the profunda femoris artery. It also gives deep external pudendal artery and muscular branches. Now coming to the femoral vein, this is the femoral vein. Femoral vein, it is a continuation of popliteal vein from adductor opening in the adductor magnus, and then it continues above as external iliac vein. Femoral vein receives, tributaries are great saphenous vein and deep veins contributing with the deep branches of the femoral artery. Then the third and the very important content of this is the femoral sheath. So this is the femoral sheath. You can see this is the femoral sheath covering the upper 4 cm of the femoral vessels. So this femoral sheath, it has anterior wall and posterior wall. So this is the anterior wall of the femoral sheath, which is formed by fascia iliaca, and posterior wall is formed by fascia transversalis. Now within the femoral sheath there are 3 compartments. This is the lateral compartment, which is also called arterial compartment, which contains femoral artery, and also this is the femoral branch of genitofemoral nerve, which accompanies the femoral artery. Then intermediate compartment is the venous compartment, and the medialmost compartment of the femoral sheath, this one, it is called as femoral canal. This femoral canal is clinically very important because it is the area of potential weakness in the anterior abdominal wall, through which the abdominal contents herniate out, and then we call it as femoral hernia. The base of this femoral canal is called as femoral ring. The boundaries of this femoral ring are medially, you can see this concave shaped. This is called lacunar ligament, which is the part of the inguinal ligament itself. Anteriorly it is formed by the inguinal ligament. This shining is the inguinal ligament. Posteriorly it is formed by the fascia covering the pectineus muscle, and laterally by the septum separating it from the popliteal from the femoral vein. So this compartment is called the femoral canal, and it contains lymph node of Cloquet or Rosenmuller, which drains the glans penis in male and clitoris in female. And the lateral most content of this femoral triangle is the femoral nerve. Femoral nerve, it arises from L2 ventral dorsal divisions of L2, L3, L4. It continues from below the inguinal ligament and then enters the femoral canal. In the femoral canal, it divides into anterior and posterior divisions, and it is the main nerve of the front of the thigh.